Good afternoon, and welcome to Health System CIO's interview with Dr. Jonah Feldman, Medical Director for Clinical Transformation and Informatics with NYU Langone Health, and Ajay Mansukhani, Senior Director, RPA and Intelligent Automation and Quality Assurance, also with NYU Langone Health. I'm Anthony Guerra, founder and editor-in-chief. Gentlemen, thanks for joining me today.
Thank you.
All right, very good. Let's jump right in. Dr. Feldman, let's start with you. You want to give me a little information about your organization and your role?
Sure. I practice as a internist and a hospitalist at NYU Langone. So I practice clinically, but I spend most of my time in my administrative role, which is as medical director for the health system for transformation and informatics.
All right, very good. AJ, a little bit about your role.
Absolutely. Hey, hi everyone. So Ajay Mansukhani, I'm the senior director. I'm here with MCIT, which is Medical Center IT, and I'm responsible for intelligent automation and a few other things here. The easiest way to explain my role is me and my team, we build bots for the enterprise. So that's the easy way. That's the best introduction I could give you then.
I want that t-shirt. Sorry.
Go ahead. What was that?
I want that t-shirt. We build
Yeah,
bots.
yeah. We built
No?
a picture of that like on your door. We build
Right.
bots. Very cool. All right. Well, the reason I reached out, Dr. Feldman, you put out a post on LinkedIn where you talked about your work with RPA bots. So why don't you tell us a little bit about that program and some of the things you've done in that area, and we'll go from there.
Sure. So I'm part of the Department of Health Informatics, and I'm kind of like the clinical informatics lead that partners with Ajay's team on our bot initiatives. I think it's important to call out that we have like kind of three pillar role members just in the technical team. Again, the clinical informaticists, Ajay and his team members. But remember that a lot of these bots use clinical systems. So our electronic health record, many of the clinical applications that we talk about, the bot uses the electronic health record actually by moving around its mouse. So we always have to have a clinical systems partner to kind of complete the triad. Ajay, maybe you want to speak about the RPA programmatically?
Yeah, sure. So we sit within technology. I report to the chief technology officer, and our unit was established to help the overall enterprise. And this is all going across the overall system, which we have, and we are a medical academic research center. We have core clinical work, we have research, we have education, and several other departments, including corporate services. So my team has been set up to establish this presence of RPA, automation, intelligent automation, whatever you want to call it, and service across this enterprise. We've been operating for the last 4 or 5 years. We've had major wins across the board, and again, it's all established across the enterprise, working through standardized tools and systems to economize and gain the benefits of putting a centralized authority around this.
Yeah, and I want to get into a lot of that the structural issues, the governance, reporting structures, and managing workflow and prioritizing requested projects. I want to get into all that. But can we talk some more about some of your wins in the area of bots, what they're doing, and we'll go from there. Dr. Feldman, you want to talk about the actual project in question?
Yes. So, we have a project where bots actually look at our electronic health record, identifying care gaps, and then bringing together in real time team members to have asynchronous quality and safety huddle, which means that via secure chat, the bot does a call for action. Here's the situation. We have a gap, for example, in medication reconciliation. Brings together the frontline staff, the attending, and the quality champion for that unit. And talk about why is there a gap, both what we can do right now in the immediate situation to close the care gap and how we can prevent care gaps like this from happening in the future.
So this is and AJ, maybe you tell me, is there a difference between a bot and an agent, or is that the same thing? Is this agentic AI where we're not just identifying issues, but the automation is taking action?
So I'll go with the discipline, right? So a bot is fundamentally similar to an agent, but in the traditional sense, like a bot is more structured around like rules-based tasks.
Uh-huh.
What is coded for a specific action based on certain parameters, etc. When we move towards the paradigm of agency or agents, we are leveraging a lot of AI included in the part of that. Agents also have powers to be indecisive in the sense that you can make decisions, or agents can make decisions based on the parameters provided on the fly. It may not be rules based. So there is a difference between these two. What we have achieved in our world is like we grew from where we were in RPA, then we started leveraging a little bit of AI, started muddy it a little bit more, and then where we are trending towards is this level of agency where we are going to assign this responsibility to bot, saying that you decide on this situation how you want to leverage other bots or other agents to make actions happen from that.
Yeah, it's interesting because we get into a lot of definitions here, right? And we get into definitions of different types of AI, machine learning versus agentic AI versus generative AI. We've got bots, and all these kind of things. And I'm assuming that, at some level it works best where the users, uh, the people in operations, the clinicians even, people like Dr. Feldman, know what they wanna do. They know what it would be nice if this could happen, if we could know this and then this could happen. And they come to you and you're like, "Oh, you don't want an agent, you want a bot." You sort of clear up misunderstandings in terms and you go, "No, I know exactly what you want." And is that how it is? Do people get lost in these definitions a little bit? Not, and I don't mean to insult you, Dr. Feldman. I'm sure you know the
No, I
definitions.
think you bring up a great point of like, where does our business, come from? And, I put it in a couple of different buckets, and then I'm going to turn to Ajay is going to talk about like how formally programmatically we try to drum up business. But the business comes from, on the one hand, in classic RPA bot thinking, and people might start with agents this way, is like someone in the organization is doing something and you say to yourself, can we, save time, save money, make it more reliable by having a bot do the same thing? And there are some, there are many, I'd say, where we're approached, hey, there's this kind of repetitive task that a group of people are doing. They would like to be focused on much more of the higher level, thinking associated with their jobs. Can you automate this process? So that's one bucket. But we found, we went in kind of thinking on the clinical side, it would be a lot of that. But we found just as much this other bucket of things that you always wanted to do. So for example, even this use case that we started with, you know, you always want to have like quality improvement coordinators reaching out in real time, talking about gaps in care. That might have been on the dream list and was on the dream list of something we always wanted to do, but there never was resources. And the bots provide scalable resources to provide a level of care, which we always wanted to do and never were able to. So I think it comes from, both buckets in terms of like how our frontline users understand, how to get into this. Ajay's team really did an amazing job. And maybe Ajay, you can talk about, how you approach that.
So I think I'm just going to go back in time a little bit. We started this in COVID 2020. We were targeting to initiate this as a program, which we did. We called it a central authority, a center of excellence, competency, and whatever you want to call it, right? So from there, we went into like, okay, let's start this program. So initially, we said let's pick like very I'm going to say easy to medium cases, and we chose like corporate services as the area where we're going to start developing this. So we kind of achieved some gains out of that. We deployed, we actually showed the value from what we actually built across the organization. And then, this started with like a series of like, education sessions where we were educating folks about the benefits of an RPA program. So then we started building from that experience, like, okay, what do people actually want? How are they looking at this as a program? Initially, we were looking at like, maybe operational efficiency. Okay, then we say, cost savings is a factor. Okay, let's look at quality. That's where these bots come into play. To even advanced cases like we're talking about revenue generation, can bots help with that? So that's the evolution which we achieved. So one key thing which we have been able to do is like we have constantly educated folks around the value of what the bots are able to achieve. And it's been like very constant, I would say, like, constant communication, education. And in fact, in cases even where like, the bots are totally autonomous, there's nothing which the human does. We've not totally eliminated the human from there. We've actually tried to kind of give them some privilege, saying that this is an assistant which you have. It's going to work on its own when it's completing its job or whatever its action is. It's going to communicate back to you what it's done. So, there is a little bit of handshake happening both ways, that's kind of constantly on at the moment. Every run, every hour, every day, whatever the bots run, they communicate to folks. And that's the program which is constantly evolving over the years, I would say.
And Ajay, we don't want to bury the outcomes. We've seen MedRec improve from 86%,
Yeah.
steady across the organization to 96%. First contact provider improved up to 99%. Things like we have a bot that looks to improve OR cleaning time throughput through the OR, and that's created a half an hour extra of OR time per week. So, many hard outcomes associated with these initiatives.
Yeah, I'm thinking like bots everywhere, right? Like, do you get a little, not that you could go overboard, but it's almost like a true believer or a zealot. It's like you're like, oh my God, you're looking all over and everywhere. You're like, bots can fix everything. Do you get super excited? And or maybe where are the areas that bots don't work right now? Are there areas where this isn't a suitable kind of solution?
Yeah,
Somebody may bring you a problem and you're like, you know what? That's not quite what we do in this with these. Go ahead.
I'll
I'll
tell you.
just, yeah, go
Oh,
on. Sorry.
no, Ajay, you go first, and I'll tell you
Okay.
a couple anecdote second.
So I mean, again, again, if I look at that process, right, where everyone was so super excited about, let's build bots, let's do more of this. So I'm going to get an assistant, I'm going to get an intern, I'm going to get a helper in my team, right? The excitement was there, but we just don't take every case as a bot opportunity, right? So first of all, we'll look at, is the business process viable and sustainable and optimal? We're not going to build technology or build a bot on a business process which is actually broken or suboptimal. It's not going to yield the best result. So there's a level of optimization which happens at that level. The next level is we want to also see that the bot's actually impersonating a human working on a system. Is there any inherent automation capabilities within the inherent system itself which allows you to automate this? You may not want to call it a bot, you may want to call it optimized business process, right? So is there some facility there which you can do to make things happen? And then again, we go into a strict discipline of evaluating every case with certain parameters. The parameters could be return on investment. Everything takes money to build or maintain or whatever that is. Is there a sufficient ROI in these cases which allow you to kind of justify building additional technology sitting on top of another technology, right? So that also plays a big role in our world. And then again, within our enterprise, we have several, I would say, operational guidelines which allow us to go through a set of um, gates, saying that, okay, this is an architecture gate, this is a security gate, and there's a business owner gate, which takes you through the steps saying that, this is a viable for product at the end of it. And then, the build process is not much, but, this is step by step taking into consideration what can be achieved with the bot.
Dr. Feldman, did you want to add something there?
Yeah, just the clinical anecdote, and some of this knowledge is built up over time. So, even in this use case we discussed, the quality and safety huddle, we had a particular clinical topic where it really made sense to have an automated quality and safety huddle. People need to be talking to each other. The asynchronous aspect really worked out, and we thought this is going to be great. We had so much success behind that. And then when we got into, we realized that the foundational decision support in the system on this topic was not there, and in those instances, the bot is starting conversations with people. They don't have the foundational basic knowledge. They haven't gotten to the point where they went through foundational decision support in the system. And we took a step back and we said, no, it probably will be a bot application one day, but we have to start building up with just, foundational, workflows, foundational decision support that the electronic health record, supports, and then the bot is kind of going as the cherry on top. That's where we see the success.
Excellent. All right, let's talk about. So you mentioned the two buckets, Dr. Feldman. One is sort of the obvious, we've always wanted to do this, and this is what we're going to do. Like there could be 5, 6, 7 use cases where you're like, absolutely full steam ahead. And then there could be the requests that bubble up from the users. And AJ, you talked about educating the users on the possible, right? That's so important that they understand, because otherwise they're not going to make the request if they don't know this kind of technology is possible. They're the ones that know the problems on the ground. You're the one that knows the technology and what's possible. You bring that to them. Now we have requests. I assume there's some mechanism for those to bubble up into some kind of process where they are evaluated and prioritized. And Dr. Feldman, you mentioned about something that's not quite bot ready, but so that's part of the evaluation. All these other things. Does the application you're dealing with perhaps inherently have some tools here where we don't need to build technology on top of it, but a process by which the request gets evaluated, bubbled up, ultimately ones are decided to get resources put towards them, and then we want to measure, right? We want to measure what the process was like pre-bot, and we want to measure post-bot. We want to show improvements in metrics and data, I assume. But tell me a little bit about that. This has been an IT issue from time immemorial, managing requests and managing work with limited resources. You can't do everything and you shouldn't. So what are your thoughts there? AJ, let's start with you.
So I think just in terms of prioritization, I mean, we have a strict stage gate where we actually present this to our senior leaders in terms of what the backlog is. And it's all decided on the basis of, yes, it's important for us to do it. That's stage one. And then secondly, which has the most benefit. So ROI analysis is done for every bot which we do. It could be that we have savings in terms of hours, we have other benefits which could be achieved, or it could be, hey, let's do something for fraud prevention. It could be something impacting quality. There's a process which is bleeding and we need to stop that immediately. Let's use a bot for that. So prioritization happens on that basis, and then it's just a matter of implementing and building on the basis of, let's prioritize the builds as well. It's not just we're going to build it take 6 months, 8 months to build something. We'll build iteratively. We'll try to stop the most inadvertent things to happen first, and then keep building from there. So it's an iterative process which we'll use, but we deploy as we kind of arrive at a minimum viable product. And then in that case, what happens is the users also get used to seeing what they're going to get in the eventual stages. And then we iteratively build further so that the eventual final product is deployed in whatever period of time, but they still see some value coming through the whole process.
Dr. Feldman, if you want to add there.
I think both in how you frame the question and what Ajay said, the key is that this is an IT question in general, and for us, we're plugging in to our strong overall IT governance in making these decisions, and therefore you have the people, as the to some extent, as the user, you need to understand your problem and put it forward. Because we're using the same governance across tools, we can say, hey, that maybe came through the bot requests, but that's actually better to go to CDS committee, and be an EHR CDS. So I think that really helps us our strong overall governance.
Yeah, that's a great point, Dr. Feldman. Um, you get what's brought to you is an issue, a problem, right? And so ultimately it may go to AJ's department or team, or it may go somewhere else. It may not be, as you said, may not be having anything to do with bots. It may have to do with something else, but they don't know that. So those issues bubble in and then have to be properly routed. Correct? Anything more you can tell me about that? Or again, that goes through established IT governance processes, so we don't need to reinvent the wheel here.
Exactly. Because the governance process is not compartmentalized, it's not stuck as a bot request. Maybe it goes to, this is really an AI request, or this is really a EHR, clinical decision support, requests, because it's really one central governance, with connectors, we are flexible enough to actually triage things the right way.
Right. AJ, what about communicating back to users, those that have requests in that are going to move forward? Maybe they just drop down on the priority list to where it's going to be yes, but not now. Based on the prioritization of the requests that have come into your team. It's been said that transparency and communication is important here, so they understand. Okay, here's what happened. Here, it didn't just go into a black box and die. Your request. Here's what's going on with it. Your thoughts on, as a service provider to your internal customers, the importance of communicating back out, and that may go through IT as opposed to you dealing directly with the users. I don't know. But at some point, those that have made requests, it's a good idea to let them know what's going on, right?
Yeah, so I think we just don't leave the leads like cold in that sense. What we have done is we've had a kind of a rhythm of building prototypes. Prototypes are like, really small, I'm going to say, prototypes of bots, or, just scripts which we develop and show the value at the very early stage of the project. And then, it's just constantly we're saying, if their priority is dropping down for whatever reason, we're just going to keep them informed about why this is going to be dropped and when we're going to be able to take it. Overall, our organization, I don't think so. We are like, we just kind of drop something and then forget about it. Uh, I have folks in my team who would perhaps be following up with the teams, trying to kind of keep the process also updated in case there's anything additional which came if you had dropped it like a couple of months. So that constant communication back and forth is on. And I think overall what we have seen is like no one just drops interest in it, saying because they really want to achieve and get some benefits out of the automated process. So it's just a constant thing back and forth in terms of communication.
And Dr. Feldman, you're probably going to hear more directly from these clinicians that have requests into IT. What's going on? What's up with my requests? So, what are your thoughts on handling that type of thing?
Yeah, I think communication definitely is key, closing the loop about the status. I think one of the strengths of our organization is that we have strong enterprise goals, strong dashboards and data visualizations that show us how we're doing in the goals, and
Mhm.
that allows us to make sure that we're all rowing in the same direction. It's important to call out that all of these bot applications that we're talking about, or 90% of them are enterprise wide. We're not going when that quality improvement bot that I described, that went live enterprise wide, all at once. We didn't start, oh, let's start with one floor and scale it
Mhm.
up.
Mhm.
Because we have the enterprise infrastructure, again, defining our goals, enterprise governance to make decisions, we're able, and the nature of the technology, we're able to scale it up, basically all at once.
Let's talk a little bit more. You alluded to the idea of if you're going to have a request, you got to bring some information with it, some research. You got to show that you put some thought into it and some research. And I've read in other areas where if somebody wanted to either take something or take something out of an order set, put it into an order set, and the idea was if you go to that committee, whatever that committee is, you better be ready. You better have done your homework. And I assume it's the same type of thing with requests that come in your area. I'd like your thoughts around that. And I'm thinking of executives like yourselves who maybe are getting flooded with requests, and this could be a mechanism of tightening up the application process, which can reduce the number of requests. And again, you're not doing it for that, but you want to make sure you're not wasting time and not going forward with things that are half baked. Your thoughts, Dr. Feldman?
Yeah, I think actually bots, and then as we start to move with agents, are potentially in a very strong position in this regard, because they are mimicking human workflows.
Hmm.
What you can say to a requester, and what I often do is this is especially in that bucket of net new, we always wanted to do it. You say, great, okay, take a champion and have them do this workflow that you want the bot to do.
Mhm,
On
mhm.
and in this case, because it's a human person, it could be on a smaller scale, so they can pick a unit, take a champion, have them do this workflow that they want the bot to do, show results before and after. Now we have strong evidence that if we can scale this opportunity, that we could really distribute the quality benefit which they found, from a select group of human champions doing this workflow. Now we can have bots doing that same workflow across all of our campuses. So that step of, asking them to, trial the proposed bot workflow with a human, and show evidence of improvement really, helps us. And again, because the bots are using the human interface, really logging into the system, using the same reports human use, using the same workflow, same clicks that humans are going to do, you really have strong evidence. If they can show that, you don't have to make assumptions that really transfers very well.
AJ, any thoughts there?
So one additional thing just to add on to that, sometimes it's about the efficiency as well. In that process, what we do is if humans are accustomed to doing it, and with human intelligence or whatever muscle power we could do, we try to even contrast in the sense saying that, okay, humans did it at this pace. We build it with bots, and what do we benefit out of it? That's a contrast which will show. Okay, fine. There's a limitation at the speed at which humans can do the quality humans can do, as bot can do this day in day out, and again achieve the same level of quality, no drop in quality, no vacations, none of that. At the same time, what we have done is also empowered our bots with invasive ways of approaching and accessing data from systems, right? It necessarily doesn't need to be the UI. At times we use like APIs or other invasive methods of getting the data out of systems and using it in that manner efficiently, so that the end output or the end result of a business transaction is much quicker or much shorter than what it would be if a human was trying to achieve.
Mhm. All right, let's talk about rolling these things out. You mentioned, Dr. Feldman, enterprise-wide. We're rolling these things enterprise-wide. When you roll out a bot, I assume that some individuals are going to not do the things they had been doing, or they're going to do things differently than they had been doing them. Change is always extremely difficult for people. That's just how we're wired, especially change we did not initiate. So, if we're not talking about the people requesting the change, and a bot is going to be rolled out that affects what people do, I assume there's a big change management piece that's got to go along with that, and communication, and don't be afraid and give it a chance. We talk a lot about in IT, we talk about selling the vision, right? As opposed to you have, there's a certain element of you're going to have to do things differently, but we try and get ahead of that by saying, here's why you're going to do things differently. Here's the upside for you. Here's the upside for the health system. So we try and sell it as opposed to force it on people. There's going to be so much of that as we do more AI, more bots. There's going to be so much change. What are your thoughts around rolling change, this type of change out to minimize resistance, Dr. Feldman?
Yeah, I think, some themes that we already touched on, but just to expand, starting with organizational priorities that are well understood, on the ground. Medication reconciliation, so crucial. No one can argue, when the bot finds a medication that wasn't reconciled, it needs to be reconciled. Nobody could really dispute that. We understand in the micro and the macro level why that's, so important. Something else, again, for the bots, we're plugging into our overall strategy in the organization for change. So
Mhm.
our, methods of communication, the same way that we communicate, the same forums that we go to talk about any of our major operational or IT changes, we're also going to, for these bots, not reinventing the wheel. And then the last thing I think is very important and helped is that intentionally, the bots are looping in local quality champions, on each of the units. So when we scaled that bot to outreach across our enterprise, part of what the bot was trained to do is that each unit has a quality champion that's associated either with the unit or with the topic, and the bot pulls that person into the conversation. And, that person has the local expertise to really, support the local change management, understand the local implications, bring that local flavor, to make sure and have the local authority. It's not just a bot, discussing with me. It's also part of the conversation is a local quality champion who's engaging. And I think that was a key to our success.
AJ, anything you want to add there?
I think there's like I said, just from a work perspective, there's so much work, right? So when we actually, I'm not going to use the word sell, but educate folks about, yeah, about a great solution for you, although it came from like 3 levels up, and we are talking to you because you're the person who's doing this job now. It's not going to impact your job on a day-to-day basis. We're talking about like educating them with value, which they're going to get. Um,
Right.
we perhaps use the word like, you're going to get a partner, you're going to get a help assistant or whatever to do some of the work which you feel is very mundane, or some work which you feel there could be a drop on quality if you were to do it, 10 hours a day, all 5 days. So there is a case which we have to explain in those situations, talk about like the real value which is going to come for the enterprise level, also benefit the individual as well, because if that individual is not doing that work, he's obviously going to go and do some other thing. So there's human centric work which could be focused around, or which could be done by that individual, leaving aside manual work. So I think it's that kind of education which we constantly talk about. And to be honest, like our enterprise has enabled it, along with, like I said, not only just the RPA world, but just usage of like IT, usage of AI,
Yeah.
that it's kind of very prevalent. Everyone's kind of aware of what's happening. So
I
Yeah.
think,
Go ahead. Go
no,
ahead.
just the promise of clinicians finally getting to practice to the top of their license.
Yeah.
Like, that's where I think this is going. Being able to do the things you always wanted to do and have support to do some of the things you didn't want to.
Yeah. And I'm sorry I'm smiling so much, but I'm just picturing the the person who enjoys doing the mundane work that you're going to take away from them, who's going to say, no, but I don't want to, I want to do this thing. I want to, anyway, it's kind of, I'm just laughing, making myself laugh here. Um, what I do find fascinating here, and what I think is so interesting, and it's great to have you both on the line because you exemplify this dynamic I'm talking about, which is Dr. Feldman having the expertise in clinical care, and of course, you're kind of got that crossover role. AJ having this deep expertise in this technology, and those two coming together to solve problems. Because AJ, I'm sure there's clinical workflows that get into a level that you're like, I don't know what's going on down there at that deep, I'm not a doctor. And Dr. Feldman, AJ can start going off about bots and you lose it. You lose the thread of what he's talking about. But that's the beauty of it, right? The beauty of it is, but it's knowing enough about each other's fields that we can work together and find solutions. It's a beautiful thing. And I'd like you to talk about how you do that. And obviously, every health system's trying to do that. Every health system's got it. But it seems like you guys got a really nice relationship. I would like some of your thoughts on how clinicians can work with IT better and how IT can work with the clinicians better. Dr. Feldman, I'll let you go first.
So I'm going to be self-critical. I'm going to be, I think, Ajay can weigh in. Like, sometimes clinicians are just way too passionate and clinical. And like, I definitely kind of can fall into that where we have like, okay, the agent project was approved and da 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 da. And Ajay has to say, wait, just start from the beginning, Dr. Feldman. It's like, less passion, just more facts. Like, definitely, I feel like and really for the clinician, and we try to, as informaticists work with other clinicians, don't solution the problem. Describe the problem you're trying to solve, and then next step, you work together to solution. The mistake often clinicians make is that they pre-solution the problem without necessarily having the deep knowledge of technology that technologists have. Ajay, was I fair in my self-criticism?
Absolutely amazing. First of all, obviously, our partnership's amazing. I mean, whatever success we've had, it's again this partnership. And one thing I like to add is like, which is a contrast. And again, I've built technology elsewhere as well, but the contrast over here is um, we've been discussing based on cases. We obviously apply a generic frame about how we need to solution things, but we go into cases deep. And then what technologists, and again, I'm being a critique of myself, when technologists initially talk about, hey, let's accomplish a project or build a bot, we're just going to complete it hi-fi, hey, complete in production, okay, assign it to an operate situation and then move away from there. But in this case, I would say in many of the bots, or I would say most of our bots, we've not gone away from it. We've evaluated it. We have seen the data, we have seen the success, and then we have seen how to modify it. So a classic case is like, I'm just going back to 2021, 22, some of the bots which we built. Now they're coming back again saying, how can we put intelligence in these bots? Because at that time, LLMs, etc., was not as prevalent, right? Now we are looking at, can we look at AI enhancing the intelligence of this and making them more impactful? Great. So we've not left the thread. We've been talking about it. We've been talking about the data, the outcomes, and the value which they've been able to achieve for our institution. So I think that's been a contrast where we have benefited the most, I would say.
Yeah, really interesting. So AJ, you talked before about the minimum viable product concept. Get something out. Don't take a year or 2 years to give something perfect. Let's start small. That's really interesting because um, I was interviewing a head of digital transformation, and she talked about, we talked about the different cultures between clinicians, transformation focused clinicians, and IT. IT sometimes can be very structured, structured in the approach because they want a product to come out the other end. But that can be challenging when clinicians are changing what they want. The ask changes. So it's almost like the clinicians want a little more flexibility and IT wants a little less flexibility and a little more definition. But when you talk about with the minimum viable product, that can sort of address that, right? Because we can start small and deliver something and then we can adjust. As you need to adjust, we can adjust. It sort of sounds like it brings what's requested and what can be delivered together in a nice way. Your thoughts, AJ?
Yeah, so I think I'll give you a case in that as well. In some cases, obviously, we build prototypes, we socialize, we build further from there. Um, in some cases, what we have done is because it's an overall organization-wide deployment, we have to take time to do the change management, to fill people in about what's coming, etc. Right? So, how do you kind of go organization-wide for these kind of situations? Like we've deployed bots only for certain physicians. In that case, okay,
Oh,
it's just used for your purpose. It's a personal assistant to you. It's going to do some things for you. Now you're going to take this further, socialize it with your colleagues and with other folks, and then show them the value. Then that adoption is becoming easier. In the meantime, what we're doing is catching up on the technology as well and making it like a fully robust, armed bot which can do it enterprise wide. So I think that minimum viable product helps us establish that situation and get the wins at the very early stage.
yeah.
We don't have to wait, and it's not like one fine day everyone's like, oh, it's all changed for us, and then they're talking between themselves saying, oh my god, we hit with this thing, we don't know what to do. So I think that's a gap which we try to fill in with these kind of things.
Dr. Feldman, anything you want to add there?
No, I think you said it, Ajay.
Works very well. All right, gentlemen, we're just about out of time. I'm going to give you each a chance for a final piece of advice. Uh, I would tee this up as say best piece of advice for someone in your position at a comparably sized health system. So you somewhere else, maybe not quite as experienced, maybe a little less experienced. What's your best piece of advice for that person? I'll let you go first, Dr. Feldman.
Yeah, I think for that person as you're getting into the bot and agent space, um, keep all what you have learned to this point. Be confident. It's not actually that different. Like that was a big theme for our discussion today. The same IT principles, the same governance. You have the tools. Yes, it's new, but fundamentally, actually, you'll find a lot of analogies to things that you've done before. So, be confident.
Perfect. AJ, again, your position at another health system. What's your advice to that guy?
So I'd say don't impose technology, don't impose it in that sense, right? Take the situation and then see if that technology fits that particular bill. And then the other thing is like, build on these partnerships. I think our program's been successful or very successful because we've had amazing partnership with the clinical informatics team, Dr. Feldman and others, and within the overall tech organization as well. So, keeping that strong for a program like RP is very essential, I'd say.
Well, I mean, I could tell the two of you enjoy working together. That's obvious. It's a wonderful thing, and I think that's certainly beneficial to the patients there at NYU Langone. Gentlemen, I want to thank you both so much for your time. I think it's going to be really valuable for our readers, and I hope you both have a wonderful day. Thank you.
Awesome.
Thank
Thank you.